Knock knock. Hi there, my name is Sarah. I'm going to be the student nurse working with you today. Before we get started, I'm going to wash my hands and pull the curtain for your privacy. Alright, can you tell me your name and date of birth, please?
Faye Ritchie, September 21st, 46.
Alright, thank you, Ms. Ritchie. So tell me about what brings you in today.
I've been having a hard time catching my breath, and I've been coughing a lot worse than normal, and I've been having this green mucus stuff come up when I cough.
Okay.
And usually I exercise quite a bit. I have a water aerobics that I do with the girls on Tuesday night.
Good.
And but I haven't been feeling up to doing it lately, and my chest's starting to feel super tight now, and yesterday I felt dizzy, that I almost felt like I was going to pass out.
Well, that sounds terrible. Let's find out what's going on. Do you mind if I do a quick assessment?
Go ahead.
Alright, I'm going to get a set of vitals on you real quick. Right, pulse ox on that hand. Alright, Ms. Ritchie, do you smoke?
Yes, I do. I've smoked since I was 23, and I don't plan on quitting.
Okay. How long does it take to get through a pack of cigarettes normally?
About 2 days.
2 days. Alright. While we wait for that to finish, I'm going to go ahead and look at your nail beds real quick. And then, can I have you open your mouth for me? Thank you very much. Alright. Alright. Thank you. Okay, so I'm just going to listen to your heart and lungs right now.
Okay.
Heartbeat's a little fast.
I feel like it's going to jump out of my heart, or out of my chest.
Oh, that sounds about right. Alright, do you mind if I look at your stomach?
Go ahead.
Alright. I'm going to take a listen. Alright, if you have any pain, let me know. Alright, thank you very much. Okay, I'm going to go ahead and set you up on the side of the bed and listen to your lungs if that's alright. Okay, go ahead and just breathe normally. Okay, go ahead and take a couple deep breaths if you can. Okay, thank you very much.
Can I
Alright,
get back to bed?
yep, I'm going to lay you back in bed. And I'm going to raise this side rail for you. Just kidding, we're going to lay that down. So for now, the doctor has given me the okay to put you on some oxygen to make you more comfortable. So that's what this is going to be, okay? Okay, and this is just going to go around the back of your head and onto your nose. Let you position that. Alright, so I have a few more questions for you. Do you feel up to answering those?
Sure.
Alright, can you tell me a little bit about your normal diet? I'm a little concerned that you might not be getting all the nutrients that you need. Do you weigh yourself very often?
No, I don't weigh myself very often, but I have toast and coffee in the morning, but recently nothing tastes good, so I haven't been really eating my full breakfast.
Okay. So as we get older, our taste buds diminish in our mouth a little bit, and that's a part of the normal aging process. But I suspect that foods aren't tasting very good to you because of the amount of mucus that you're coughing up. That, teamed with the amount of work it takes for you to eat and breathe at the same time, makes things pretty difficult. So we're just a little concerned that you're not getting all the nutrients that you need on a daily. So the doctor would like to obtain a sputum sample to make sure you don't have any upper respiratory infections going on that we don't know about. Dr. Phil is here on call with us tonight, so I'm going to go track him down. We're going to go over my assessment, and then we'll go from there, okay?
Okay.
Alright, are you feeling okay with the oxygen right now?
I'm okay.
Okay, I'm going to put my pulse ox back on you, and we're going to monitor continuously your O2 stats.
Okay.
I want to get them up to around 95%.
Okay. Thank you.
Alright, so your call light's right here. Right here at your side.
Alright, thank you.
And I'll be right back. Knock knock. Hi there, it's your student nurse again. Before we get started, I'm going to wash my hands and pull the curtain for your privacy. Alright, so how are you feeling?
I'm doing much better.
You look better, that's good. If you don't mind, I'd like to take a new set of vitals and listen to your heart and lungs again.
Okay.
Your stats look way better. That's good. Alright, so I'm going to go over a couple things with you. I've collaborated with the doctor, and based on the assessment findings and your lab results, he is diagnosing you with COPD.
Am I going to live?
Yeah. COPD stands for chronic obstructive pulmonary disease, and what that means in your case is that you have inflammation and mucus lining your airway, and that's what's making it hard for you to breathe. Our concern is that when oxygen can't reach your lungs, then it can't reach your blood and travel to your organs that need it to function, like your brain, and that's probably why you were dizzy the other day. So we have some medications that we're prescribing for you. Salmeterol, or Ceravent, is an inhaler that you'll take twice a day, normally in the morning and then again at night. This is to prevent any attacks or any flare-ups or almost like an asthma attack, kind of like that. Guaifenesin is another med that we're adding. It's a tablet. It's 200 milligrams. You'll take it once a day, and that's going to kind of loosen up your secretions and liquefy them and make it easier for you to cough them up or just breathe easier. The goal is to keep that airway clear. And then, like we gave you earlier, we're going to give you an albuterol inhaler as well. And this one's different from the other inhaler. This is just for, like a rescue inhaler almost. Just in case you feel a flare-up coming on, you can use that, and that'll help you with those symptoms. I'm sure you've been instructed to stop smoking once or twice. I know it's a really hard habit to break, but I can't stress enough the how much stress it puts on your lungs. Inhaling anything like that is going to worsen your COPD symptoms. And then as far as diet goes, the doctor encourages you to eat smaller, more frequent meals. That way you don't have to work so hard to breathe eating one large meal 3 times a day. He also recommends that you increase your fluid intake to liquefy those secretions. That'll help with the medication that you're taking too. Do you have any questions for me right now?
That's a lot to take in. No, not right now.
Yeah, it can be hard to adjust to a new medical condition, but that's why we're going to give you a dose of meds tonight, and then we're going to keep you overnight to monitor your progress, make sure you don't have any reactions or anything like that. And then we'll teach you some deep breathing exercises, and we'll send you home with everything you need to carry on your normal day-to-day activities.
Okay.
Okay? So, your call light is right here. If you need anything, you can give me a call, and I'm going to go ahead and remove this off your finger. Alright, hit the button if you need anything, and thank you.
Thank you.